Classification of the drugs commonly used in dentistry. First is sulfonamides. They are the first drugs which were used as antibacterials. They are not known as antibiotics. They are named as chemotherapeutic agents because they are not produced from bacteria. They are manufactured from chemicals. So they are called as chemotherapeutic agents. Antibiotics, in that penicillin, cephalosporin, macrolides, clindamycin, that is another class of medicines, tetracyclines, aminoglycosides, not commonly used in dentistry, but some you can use. I will tell later on. Quinolone derivatives, you know which are the quinolone derivatives, Dr. Daich?
Yeah, this is used especially for pediatric.
No. Antifungal, I will tell you later on. Antifungal antibiotics. Then you have NSAIDs, anti-inflammatory drugs, enzymatic anti-inflammatory drugs, sedatives, antidepressants, because in Western countries, the dentist can advise low-dose antidepressants in TM joint dysfunction syndrome. Now, first of all, I'll take up with sulfonamides. Sulfonamides, they are used as antimicrobials. Sulfonylureas, they are used as anti-diabetics. Okay? Diuretics, chlorothiazide diuretics are also sulfonamides. Anti-epileptic drugs, there are certain classes of drugs, anti-epileptic, they come under sulfonamides also. Antiretrovirals, which are used for treating HIV. Then miscellaneous sulfasalazine, sumatriptan, and apricoxib. Sulfasalazine is used to treat ulcerative colitis. Sumatriptan is used to treat vascular headaches. Apricoxib is a COX-2 inhibitor. They are very effective anti-inflammatory drugs, but later on they were withdrawn because they cause severe hypertension and even heart problems and CVA in a lot of patients. So I will discuss mainly the mechanism of action of antimicrobial sulfonamides. Basically, they inhibit the synthesis of folic acid in bacterial cell wall, because bacteria, they synthesize their own folic acid by their cells. So this is the enzyme dihydropteroate synthetase inhibitor. This is how they inhibit bacterial cell growth. So they are bacteriostatic, not bactericidal. They don't affect the human cells because human cells, they don't synthesize their own folic acid. We get it from dietary sources. But since it competes with folic acid or it interferes with folic acid synthesis, they can cause anemia. Nutritional deficiency anemia, basically. But there are some complications. Before, in 80s and 70s, we were extensively using sulfonamides to treat dental infections. Commonly used still, I think you know this Bactrim or Bactrim. You know it? Bactrim, this is sulfamethoxazole with this trimethoprim. There is a combination. It is used for treating dental infections. Then you have the complications are urinary tract infections, hemopoietic disorders can cause anemia, Stevens-Johnson syndrome, and toxic epidermal necrolysis. Agranulocytosis, hemolytic anemia, and thrombocytopenia is one of the complications. So now these days, generally we are not using, but medical specialists are still using sulfonamides, especially Bactrim, for treating certain conditions. Infections.
But not dentistry.
Dentistry you can use, but we are onto amoxicillin and other bactericidal drugs.
A good substitute.
Yes. Acute pancreatitis also caused by sulfonamides. Now we have cephalosporins. These are also antibiotics, the same spectrum almost as penicillins, but the second and third generation have more gram-negative spectrum. Even first generation also, they are also mixed this thing, bacteria which can be affected by these these antibiotics. Even cephalexin has a spectrum of gram negative as well as gram positive bacteria. But they are generally not effective in periodontal conditions like this aggressive periodontitis. They are not the drug of choice. They can be used to treat dental infection, but not periodontal tissues. Cephalexin is the first generation drug. It has also gram negative and gram positive spectrum. Its dose can vary from 250 milligram to 500 6 hourly. Cefadroxil is another drug in first generation. It is as better spectrum. The dose is, the common name is, I think, Keflex, I think. 500 milligram 12 hourly. Okay, or for pedia, it is 50 milligram per kg per dose. That means you have to give 6 hourly. Then Cefridine. This is known as injection Velocef. This is injectable. This is 250 milligram BID or QID depending on the severity of infection. You can give up to 1 gram in severe infections, 25 to 50 milligram per kg per day. You should differentiate between per dose and per day. Then you have cefuroxime. This is known as Zinacef. This is injectable, basically. This is also given 250 milligram to 500 BID for up to 3 gram maximum dose, 15 milligram per kg per dose. Then ceftriaxone, 1 milligram BID. This is adult dose. 1 gram BID, 50 to 100 milligram per kg per dose. If you want to adjust for, they are this second and third generation, cefuroxime and ceftriaxone, you can use injectable, and they are very effective for treating dental infections, especially when there is patient. Generally, I am talking about personal use. I generally don't use augmentin because 1 or 2 patients I have found they are found to be resistant to amoxicillin because they are commonly given. So I already start ceftriaxone. It is available with the name Rosefin. Yes. So this is very effective in treating dental infections.
And also it's given pre-operative cases.
No, it is only available IV only. This is not oral.
This is IV.
Yes.
They will give you IV.
Yes, that is called or antibiotic prophylaxis, not pre-operative. Antibiotic prophylaxis. Antibiotic prophylaxis I can also discuss next because there is a lot of changes in that. I can discuss in next lecture. I can discuss, no problem. All cephalosporins, you should take precaution. There is cross sensitivity with penicillins. Okay. Thank you very much. Really, you can manage it. Dr. Dey, you can manage this later on. Okay. When you are giving cephalosporins, you should be careful. Take history of any allergy to penicillins. If there is no history, you should always write on the prescription sheet or order that should be done after sensitivity test. Okay. Then you have macrolide antibiotics. That is erythromycin. It is erythromycin. These macrolides are bacteriostatics. They are not bactericidal because I am not going into details of the mechanism of action. Tacrolimus. Anyone knows about tacrolimus? Anyone? Of course, I don't expect from you. Tacrolimus is used for this is cyclosporin A. What is that? That is immunosuppressant. This is a substitute for, okay, thank you very much. Cyclosporin. This is a substitute. It does not cause gingival enlargement to that intensity as caused by cyclosporin. This is tacrolimus. Then amphotericin B. Anybody knows what is this amphotericin?
In the late stage, we can give this.
What?
Uh,
Which you are talking about?
This is the last choice cancer.
Which one?
I forget it.
Amphotericin B is antifungal antibiotic. It is given IV only in advanced cases.
Advanced.
Yes.
Late stage.
Yes, when the infection cannot be treated. This nystatin also comes under macrolides. Okay. This oral lozenges are available. You can give 1 or 2 lozenges. The units is mentioned here. 200,000 to 400,000 units, 4 to 5 times daily. Or you can give oral suspension, 500,000 units, 4 times per day. But most of these preparations may contain sugar. Okay, so you have to be careful if the patient has got lack of saliva or there is dry mouth. In the book, it is mentioned you should tell the patient to use vaginal troches. These are type of tablets you can dissolve in the mouth. They don't contain sugar. Then you have tetracycline. Okay, just wait. This macrolide antibiotics, erythromycin, we had used previously very commonly. But main problem with these antibiotics, they have to be taken empty stomach. Cause a lot of gastritis, severe gastritis. Azithromycin is a very good antibiotic. Even after 3 days of you stop the drug, the level is maintained up to 9th day. Azithromycin dose can be 250 milligram to 500 milligram per day. Okay.
So you should not give with empty stomach, right?
No, you have to give this empty stomach. This is problem with the macrolides.
If it will do gastritis, why
You have to give, no, because sometimes like azithromycin, there is no drug of choice. Like patient is allergic to penicillin, for antibiotic prophylaxis, you have to use azithromycin, 500 milligram single dose.
So we should give antacid with it? Or?
Yes, you can add. Azithromycin is a very good drug. Please don't, no gossips, no fun. I will try to put this lecture on YouTube, no problem. Azithromycin is a very good drug. Erythromycin dose is as same as amoxicillin. Okay? Azithromycin. Erythromycin? Yes, you can give 250 to 500 milligram QID per day. QID per day. Or if you want to give prophylaxis, 2 grams. Azithromycin, you can give 250 milligram to 500 milligram, either single dose or divided doses. For prophylaxis, you can give 500 milligram azithromycin is more than enough. No need for 1 gram. Tacrolimus is immunosuppressant. It causes less gingival enlargement than cyclosporin. Amphotericin B is IV antifungal, is given only in severe cases of fungal infections. Then you have tetracyclines. In tetracycline is tetracycline base drug, minocycline, and doxycycline. You know anything about tetracycline, where they are used? No. First I am talking about indications.
Perio.
Yes, he is correct. They are used specifically for treating aggressive forms of periodontal disease. Tetracycline base drug these days is less in use because you have to give 250 milligram for 4 times daily. And that is given for 14 days. That way, doxycycline 100 milligram OD dose is more convenient. Once daily dose is more convenient than 4 times daily. So doxycycline is preferred drug than tetracycline. Minocycline you can give also. That is 100 milligram BID. In Western countries or in Japan, they have triple antibiotic paste, which consists of minocycline, ciprofloxacin, and metronidazole. This is called triple antibiotic paste. They are using for generally root canal dressings. But tetracycline problem with base drug is that it is chelated by calcium ions. So you cannot give with certain food items like milk. should be avoided. Staining of teeth is another issue for children, should be avoided in children below the age of 14 because it can cause staining. It is inactivated by metal ions. Should not be given in that list is given even in your books that I will explain later on. Now quinolone derivatives. You know any name of the drugs which is quinolone derivatives? No problem. Any one of you? Quinolone derivatives. This is ciprofloxacin. This name is ciprofloxacin. This is very effective against all gram-negative bacteria from oral cavity. You can use for treating dental infections, periodontal infections, very effective also. You can use this in treating aggressive form of periodontal disease. The usual dose is 500 milligram BID. It should be avoided in patients who are pregnant females, children below 12 years, but it is available as syrup here. I don't know how they allow it, but some physicians are telling now they have removed that condition. They were thinking before there was a theory that it interferes with the metabolism of cartilage, so should not be prescribed in children below 12 years or 14 years of age. Should not be given if patient is taking phenytoin, anti-epileptic, because it interferes with the interaction. There is interaction of both these drugs. Cephalosporins should be used with caution if the patient is taking warfarin, anticoagulants also. Ciprofloxacin I am using, it is very effective because it is less commonly used here, first of all. Any drug which is less commonly used will give you immediate effect. Ciprofloxacin is less commonly used.
Here they are only
using amoxicillin.
Gastritis.
Huh?
No, for gastritis when
Yes.
amoxicillin and
Yes. If patient has got gastritis long-standing, there are researches that this bacteria which causes gastritis, Helicobacter pylori. Helicobacter pylori, that can be given with ciprofloxacin and ciprofloxacin, metronidazole, and this, which is that, no, that antacid.
you mean Moxal?
No, that proton pump inhibitors.
Yeah.
That is very effective in treating gastritis sometimes, which is caused by Helicobacter pylori. Now, clindamycin. Clindamycin is also a very good drug in treating gram-negative bacteria, the infections caused by gram-negative bacteria.
Nexium.
Huh?
Nexium. Proton pump inhibitor.
Yes.
Nexium.
Yes. And there is omeprazole. Omeprazole. Yes.
Then
Omeprazole. Yes.
Nexium.
If you go to higher drugs, the lower drugs will stop. There is so many drugs these days, and there is in India another problem is they will make combinations, so you cannot avoid. Clindamycin, this comes under lencosamide type of antibiotics. This is effective against anaerobic bacteria. It is effective against all periodontal pathogens. Dose is for normal infections 150 milligram to 300 milligram every 6 hours. For severe infections, you can give 300 to 600. For antibiotic prophylaxis, 600 milligram IV single dose. The maximum dose is 2,700 milligram per day. For children, 8 to 25 milligram per kg per day. What is the main side effect of this drug? Anybody knows? It causes, even if you give IV, it causes severe pseudomembranous colitis. That means diarrhea. Of course, any antibiotic can cause pseudomembranous colitis, but clindamycin is more notorious in causing pseudomembranous colitis, even if you give IV. Then you have aminoglycosides. Aminoglycosides are basically for treating gram-negative bacteria infections. First drug in that was streptomycin. Streptomycin was used for treating tuberculosis. It is still used. Tuberculosis. Amikacin can also be used for treating IV. It is given IV. Streptomycin and amikacin both are given IV. The dose for this is 15 to 22 milligram per kg per day in 3 doses. For adults, 500 milligram TID for 5 or 7 days. For dental infections, you can use, no problem. I have used previously. But then gentamicin is commonly used for urinary tract infections. It is also given IV, 1.2 to 2 milligram per kg per dose. You can give in 2 or 3 doses. But main problem with the aminoglycosides, do you know anything? What is the main complication of aminoglycosides? Streptomycin causes ototoxicity. Okay, this is the maximum dose, 120 milligram per dose, 8 hourly. Then you have metronidazole. No, ototoxicity. It causes problem with the nerve, eighth cranial nerve. Then you have metronidazole. It is, everybody knows, combines well with any other antibiotic. You can combine with ciprofloxacin. You can combine with tetracycline. You can combine with amoxicillin, or yes, you can combine well with the cephalosporins also. You know, I think the dose. Drug interactions should not be given to people who are chronic alcoholics. Here it is not so common, but in Western countries and in India, you have to be careful. Should be careful when the patient is taking anticoagulants. It increases bleeding and clotting time. Then you have antifungal antibiotics. Miconazole and nystatin and amphotericin B, I have already told you. Miconazole and clotrimazole. For dental use, generally you have to use locally. No need to give systemic. If you have to give systemic, you send the patient to medical OPD, or if he has other fungal infections, can be taken consultation with derma also. In this also, since you are telling the patient to use locally inside the oral cavity, again, it is resorbed in the bloodstream, absorbed. So you should be careful when the patient is taking warfarin, digoxin. These are the drug interaction, methylprednisolone, cyclosporin, and tacrolimus. These are the drug interaction. You should be careful. It can increase bleeding time. Digoxin, it can interfere with the drug action. Digoxin is given for congestive heart failure. Yes. So these are the common interactions of miconazole and clotrimazole. Vinca and colloids, I don't remember now which this used for. Anyway, if I have mentioned here, I should know it. Then antivirals. Antivirals basically for dentists, it is acyclovir. There are many antiretrovirals, and dose is 400 to 800 milligram. It is generally given 5 times daily. You can reduce it to 3 to 5 times. For children, it should be 10 to 20 milligram per kg per dose. Again, 5 times. Like if the preschool children, which kind of infection is very common? Viral infection in the oral cavity. Preschool children. Oral I am talking about. Yes, I am talking about viral infection. Here once I am mentioning antibiotic. Yes, herpes simplex infection is very common in preschool children. Okay. So you can even use acyclovir eye ointment. Any eye ointment can be used anywhere in the body, because these days I am using tetracycline ointment also. That is, only eye ointment is available, but you can use in the oral cavity also. Because eye ointments are the safest to be used anywhere. Because eye is a very sensitive organ, so eye ointment is available, you can use in the oral cavity.
So what was the infection you mentioned?
Herpes.
Herpes?
Yes, herpes simplex.
Stomatitis?
Herpes simplex. Yes, herpetic stomatitis. Yes, that is very common in preschool children. NSAIDs you are very commonly using. Most commonly used are aspirin and brufen. Ibuprofen. You know the dose for ibuprofen? Yes, 400 to 600 milligram TID you can use. Diclofenac sodium is very commonly used by the dentists. But in my opinion, this is more effective in musculoskeletal disorders. In my opinion, diclofenac is more effective in musculoskeletal disorders, not in dental infections. The dose for diclofenac is 500 milligram TID you can give. Oh, sorry, not 50 milligram TID you can give. Or BID or TID. These days in India we have sustained release diclofenac sodium capsules or tablets are available, so you can give only 100 milligram single dose.
So this sodium you will not give with patient with blood pressure?
No, itself, diclofenac sodium itself can cause any anti-inflammatory, can cause increased blood pressure, any anti-inflammatory.
They say that you will substitute the sodium by potassium.
Some companies are manufacturing potassium salts also. Yes. But again, potassium level also is very critical. It is very narrow range. So if you interfere with that, that can also. Mefenamic acid, it is very commonly used also in India. 500 milligram TID. COX-2 inhibitor. Approximately 10 years ago, COX-2 inhibitor drugs came to market. They are known as Refcoxib. It was very effective in treating pain. There was very low dose, 50 milligram BID you'd give, and it's very effective in controlling pain. But later on, there were lawsuits in USA. It caused severe hypertension. So they were withdrawn. COX-2 inhibitors. This COX-2 is one of the pathways of inflammation. That is why they are known as COX-2 inhibitors. Side effects, gastritis, I think all of you, they can cause severe gastritis, ulceration, irritable bowel syndrome, bleeding. You should avoid in patients who are having history of bronchial asthma, renal failure, should not be given at all. Hypertension patients, I generally try to avoid.
Also, patient who is on anticoagulants should not.
Yes.
What for that?
Anticoagulant, hemophilia, those should not be given anti-inflammatory, non-steroidal anti-inflammatory drugs. Sorry, I forgot to mention here enzymatic anti-inflammatory drugs. They generally are, because they disintegrate the tissues. हेलो अभी बाद में बात करूँगा. नो दिस इज ऑफ. हेलो बाद में बात करूँगा. अभी मैं ज़रा बिजी हूँ. This. Huh? This one? Yes, I on it when I was started. Yes, it's still. Enzymatic anti-inflammatory drugs. They disintegrate the tissue at the area of inflammation. In India, it is available with the name of serratiopeptidase. I don't know, here also somebody was telling me, you have to try to find out from pharmacies. Not in our pharmacy in the hospital. It is available outside. Serratiopeptidase. Then I forgot to mention about paracetamol. It is a very good painkiller to be used. It can be given in patients with bronchial asthma, patients having hypertension. It doesn't generally cause allergy. But whenever you are giving any anti-inflammatory or analgesics like paracetamol, should be careful about liver function also. All these drugs are very severe on liver function.
So if the patient is in pain and he has hepatitis C or B, what do you give?
Then you will do liver function test first and take opinion from the physician. That is the best way.
And give drugs metabolized in the
Okay, which drug you can give? Can you name any? Because I don't have any knowledge. Then you have to take, of course, you can take consultation with physician to give you opinion. You can do liver function test. If it is normal, you can give normal dose, and you can repeat liver function test during the treatment. And if generally, if I am in doubt, I will always take opinion from physician. There is not an issue. Then steroids. It can be given oral, can be given parenteral, local. Oral can be they are given for treating autoimmune diseases. Lot of autoimmune diseases treated by steroids. The dose sometimes can vary up to 100 milligram or 60 to 100 milligram per day. Very high doses. Parenteral you can give in case of emergency. You can give like patient comes with severe cellulitis or Ludwig angina. You can give parenteral steroids like dexamethasone, 8 milligram IV or IM. You can give BID or maximum dose up to 20 milligram. For I think for children you can always for pediatric patients you can always take consultation with the pediatrician. Local use, they can be used for many allergic conditions. They can use for autoimmune conditions in the oral cavity like lichen planus, you can use in pemphigus. Parenteral you can use in emergency. Hydrocortisone is used for treating any anaphylaxis. Oral drugs are used commonly for short period, like you have even me. If I have sore throat, I have fever, I take 1 or 2 days, 5 milligram prednisone. But for long use, when the patient is using for longer than 15 days, high doses, then you have to increase the dose of steroid, yes, or at the time of dental procedures. Because the indigenous steroids cannot compensate for this stress. Then sedatives. Here it is a big issue in Saudi Arabia. Otherwise, in India or Western countries, dentists can prescribe sedatives to the patient. 5 to 10 milligram. You can prescribe diazepam or midazolam before dental appointment, and they are used in conscious sedation also. Diazepam, midazolam. And other muscle relaxants like chlorzoxazone. There is another one they are using here. Which one they are using? Muscle relaxant.
They are using this one, and they are using injectables.
Then there is nitrous oxide also can be used as muscle relaxant, conscious sedation. All these drugs can be used orally, IV. Of course, chlorzoxazone, only oral preparation is available. Diazepam and midazolam. Now, penicillins. Huh?
This is the problem.
What?
Benzodiazepines can be addicted. You can be addicted to it. This is the problem.
Not always addictive. Patients are taking it for 1 or 2 times. It will not cause you addiction. Only if you are put on long-term use, only then it causes. This penicillins I have included in the last because we are no more using it. These are the penicillin. It is a general term for use for generically produced benzyl penicillin before, which was known as penicillin G. It was discovered in 1928 by Ian Fleming, I think. Some Fleming, I think his name, because this is of historic value. But they are still using as prophylaxis these days. Still using as prophylaxis for patients who are susceptible for bacterial endocarditis. Procaine. There are many drugs at that time came into market. Mostly they were injectable, but there were some oral penicillins also, but they were not very effective because and they are very commonly known to cause allergic reactions in 3 to 10%, depending on the research done. 3 to 10% patients can be allergic to penicillin.
So give them erythromycin?
Yes, at that time they were given erythromycin, and at that time. Now you have a lot of drugs like azithromycin, or you can use ciprofloxacin, clindamycin. You can use. Then you have semi-synthetic penicillins these days. Of course, should be avoided in allergic patients. This is ampicillin, amoxicillin, or augmentin, methicillin. Methicillin is a very narrow-range antibiotic, is only specifically effective against Staphylococcus aureus. That is why they call. You might have heard the term MRSA, methicillin-resistant Staphylococcus aureus. Drugs, I think you all of you have this list of drugs having contraindication in renal diseases: aspirin, benzodiazepines, opioids, antihistamine sedatives, NSAIDs, erythromycin, metronidazole, decrease the dose, paracetamol, also decrease the dose. Tetracycline should not be given in renal. Hello, Zairil. You will also attend our lecture. Phenofexidine, you know about this drug? This is also an anti-allergic drug. It is less sedative than chlorpheniramine or cetirizine. I don't know. Allegra. It comes with the name of Allegra. This is given up to 180 milligram per day. Then relative contraindication in liver disease, acyclovir, penicillins. This arrow downward shows decrease the dose. All opioids should be avoided in liver diseases. Amphotericin, sorry, spelling is wrong. So, cephalosporins should be decreased dose. Clotrimazole, this is same sulfur drug. Clotrimazole, sulfamethoxazole with trimethoprim. It is also known as clotrimazole. Common name is Bactrim. It was commonly used for treating bacterial dental infection earlier in 70s and 80s. Benzodiazepines, then you have NSAIDs, tetracyclines. Liglocaine, reduce the dose. Drugs relatively contraindicated in pregnancy and breastfeeding: aspirin, benzodiazepines, carbamazepine, all opioids, clotrimazole, all sulfur drugs should be avoided in pregnant females. NSAIDs, tetracycline, metronidazole. Metronidazole in second trimester now these days they say you can give. But if the patient is pregnant, you can always take consultation with the gynae specialist.
But doctor, the safest antibiotic for a pregnant patient is penicillin, right?
Yes, penicillin derivatives or semi-synthetic. Then some of the pediatric doses for commonly used medicines: amoxicillin 30 to 50 milligram per kg per day, metronidazole 25 to 30 milligram per kg per day, paracetamol. Now see the difference per kg per day and dose: 20 to 15 milligram per kg per dose. You can give paracetamol 4 doses daily. Ceftriaxone, that is Rosaphene, commonly available injectable cephalosporin third generation. You can give 50 to 100 milligram per kg per day. Ibuprofen 7 to 10 milligram per kg per dose. This is the latest defibrillator, Doctor. Latest defibrillator. Now emergency drugs. You can keep one here for your CPR. No, you can do defibrillation. Emergency drugs: oxygen, adrenaline. You know how much can be given?
I think it's oxygen 16 milligram per liter.
I don't know much dose about it. Because I know about adrenaline. Adrenaline 0.3 milligram subcutaneous. Maybe he knows because he is teaching ACLS also and.
From 5 to 10, this is the regular dose for oxygen. 5 to 10 liters per minute.
Okay. Hydrocortisone injection during anaphylaxis is very effective. It stabilizes the cell membranes and increases heart rate also. I know he is using teaching during BCLS. Glucagon 1 milligram powder. It can increase blood sugar level immediately. Because sometimes patients go into hypoglycemia. You should have glucose or sugar with you in emergency. Salbutamol inhaler for patients who are asthmatic. Of course, as a patient gets asthma attack, you can use even adrenaline and hydrocortisone also.
And nitroglycerin.
Yes, I will come. This aspirin is there. Also is used as emergency drug if you are suspecting MI for the patient. Then midazolam for sedation. Maybe I have forgotten. Nitroglycerin, yes. You should also add something. Now be careful. Don't believe that pharmaceutical industries, they are on your side. They are there to make profits. So you should use your medicines judiciously. I hardly ever use any mouthwash or antibiotics for treating gingivitis or periodontitis. I have shown to Shada that previously some people are using in young patients doxycycline. You know, Salma, our previous periodontist.
They are using erythromycin with these small children so that they will get well soon, and it is
No,
coming in
come back.
private.
Huh?
Back.
Okay. Which one?
Yeah. Okay.
I'll try to put this on YouTube. I have a YouTube channel. No, wait. Don't be in hurry. You are the one who delayed it, and then you want to be in hurry. Okay, just wait. Medical science has made such tremendous progress that there is hardly any healthy human left. This is also a quote from, I don't know the name, I don't know him. Health does not depend on the medicines. Most of it comes from your peace of mind and heart and soul, comes from laughter and love. This is an anonymous quote. These are natural remedies for common ailments. Next time after I come back from vacation, we will have a lecture on Shada, what will be your topic? I will have a lecture from her after I come because I want to contribute in that. Salma, she knows about this oil pulling. So we will have this on natural or kitchen items which we can use for treating your common ailments. These are the food items you can use for treating your ailments. No need for drugs. The end.